circumstance tonight. Kind of stuck in between a couple of groups on this issue, but consistent with what the City Council has asked me to do, I initiated the study of the differences in the Heber City and Heber Light and Power personnel policies. I'm not going to go over this 18-page report plus 5 exhibits in real great detail. You should have that before you. But I'll probably more or less cover my observations. I've tried to avoid making recommendations, but you will see there are differences in the benefits that are offered to two different organizations. I too agree with the comments that have been made about the dedication of the employees and the quality of the product that Heber Light and Power delivered, and I would indicate that Heber City does similar things in water and sewer and other utilities. Because both entities are public in nature, I believe it's important that an equitable balance be struck between the employer, employee, and citizen owners by providing a quality service at a reasonable price and a fair wage and benefit package for those services performed. And in my report I've said because Heber City owns 75% of Heber Light and Power, I would probably expect to see more similarities in benefits and policies than I would expect to see differences. Based on the elected officials that serve in both capacities for Heber City and Heber Light and Power. And as I make remarks tonight, I want to just reinforce that my report is not intended to discredit, criticize individual employees, management, or elected officials who have or currently have involvement in either company, City or Heber Light and Power. I would also note that as I've asked questions and asked for information, Heber Light and Power staff, specifically Mark Miller, has been very accommodating in providing me the information, the answers, so I hopefully have made a fair assessment and observation on the difference in the two policies. In a way that suggested that I'd be making recommendations tonight in the do you know such section, but it's not quite going to work that way, Laurie. And I am a little bit nervous having 3 Coleman sisters in the room. I know how feisty they are. But with that, I'll just make a couple comments. As I reviewed the policies, the first thing that I'm going to note is most of my focus was on things that have financial implications in the benefit side. But there are a few observations that may not. Because one of the assignments that I was given in the resolution adopted by the City Council was to look at implementation of House Bill 17. I would note that Heber Light and Power, in their Section 3, ascribes to GRAMA, or Government Records Management Act, which is something that cities are required to adhere to as well. I note in Section 6 that there are some policies that exempt managers have that are different than other rank and file employees, and I'll highlight those differences in the insurance, vacation, and sick leave sections. Just briefly, each organization has the ability to provide incentive awards. They're not great in amount for the number they're giving out, so I don't think that's a real issue that needs much discussion. They both have comp time policies. Heber City allows their employees to accrue a maximum of 80 hours, and if they're not used within 60 days, they have to be paid out. Heber Light and Power allows for only 24 hours of comp time within a year, and it has to be used within that same year. But I don't think either policy has a significant financial impact on either organization. On-call policies. We both have employees that are responsible to respond to emergency situations. And I would say that the policies are fairly similar. People like Powers' compensation is higher, but if you look at the wages of the linemen that to perform those on-call type duties, the compensation feels pretty similar. They have to work 3 hours before they're compensated an overtime rate. And we have weekend duties in checking the wells and springs to make sure that they're functioning properly, that are part of that on-call policy. So I think they're fairly similar. Probably where we have some of the most significant differences is in health insurance benefits. And really there's 3 different areas there. There's what health insurance policies that each entity provides, what consideration they give if people choose not to take the insurance, and what benefits do they provide to retired employees. And so this first slide will first tell you the types of policies that each entity offers, what the cost of those policies are, what employer and what employee participation is, and what the annual cost is to provide those insurances to the different for the different coverages. So in the combined monthly premium that represents health, dental, and vision care premiums, Heber City only offers one insurance program. It's a high deductible health plan with a health savings account. Basically, the cost for that program is shared between the employer and the employee. In our case, for family coverage, it costs the city $15,755 for those 3 coverages, and the employee pays a little over $200 a month as their participation in those programs. Heber Light Power, and then you see the 2 parties and the cost. Heber Light Power offers 2 plans. One's a traditional health care plan, which has a fairly low deductible and probably 80-20 coverages after you meet that. 80-20 coverages after you meet the deductible will tell you how high the maximum. Their same cost for the traditional plan versus Heber City's is $19,120. They also offer the Advantage Start program, which is an HDHP with HSA, high deductible health plan. And the cost of that plan is $17,900.60 with dental and vision as well. Heber Light Power doesn't require their employees to participate in any of the premium costs. So both entities offer some consideration to employees that choose not to take the insurances available to them if they can provide proof that they have coverage from their spouse or some other man. So in Heber City's case, we pay 50% of our normal cost that the employer would pay to the employee for the program for which they're eligible. In Heber Light Power's case, if you're an employee hired before January 1st of 2014, they provide the full traditional family cost of $19,120 to those who do not take the insurance, regardless of what insurance they're eligible for, single, 2-party, or family. After January 1st of this year, they pay at the same rate that Heber City does, at 50% of that amount. And if you are a single or 2-party employee, as I understand it, if you take the insurance, they'll pay the difference between the cost of a single or 2-party insurance policy and the traditional family, in addition to providing the coverage. So this just annualizes what those costs look like. Let's see, no, I'm sorry, this is retirement benefits. So with regard to retirement benefits, in your packet I've provided you a summary of the different criteria that's used to determine what retirement benefits an employee is eligible for. I don't have it as a slide before me here tonight, but any employee hired before July 1st of 2011 with 25 years of service at Heber Light and Power receives 5 years of insurance or until age 65, whichever is shorter. If they have 30 years of service, they get 5 years of coverage or until age 65, whichever is longer. For a regular employee hired after July 1st of 2011, they get 5 years of coverage until age 65 or until eligible for another insurance from another employer. And for exempt managers that were managers before January 1st of 2014, if they have 25 years of service, they receive. And the benefits that are offered for retirement at Heber Light and Power include medical, dental, and vision coverage. But for a manager with 25 years of service hired before January 1st of 2014, they are eligible for the retiree and their spouse until they turn age 65. For an exempt manager that became a manager after January 14, they have the same benefits available as the regular employees. In Heber City's case, all employees are eligible for health insurance continuation with 25 years of service for the retiree only, up to a maximum of 5 years or age 65 or until they become eligible for another insurance from another employer. And I think one of the reasons Heber City chose 25 years is that a fourth of our workforce are police officers, and they're eligible for retirement at 20 years. And so they still have to stay 5 years longer than what they could have retired. But that's one of the reasons it's highly likely they'll seek employment elsewhere after they retire and would become eligible for insurance somewhere else. And that's one of the reasons that we've adopted that policy. And we offer, for those that are age 60 to 61, 20 years of service, the same consideration, insurance continuation until they're 65 or until they're eligible for insurance from another employer. And age 62 to 64 for 10 years for the retiree only until age 65 or until they're become eligible for insurance from another employer. To try and, I guess, provide an avenue for early retirement. I will note in my report I've indicated why Heber City has chosen only to offer the high deductible health plan, because we think that it will ultimately result in lower premium increases. It gives the employees more incentive to be good consumers. It allows the employees an opportunity to make tax-exempt contributions to a health savings account, and because of lower utilization, lower increases in premiums. Excuse me. One of the things that you'll note here as well is that our policies are a little bit different regarding retirement. That Heber City's policy indicates that we can provide them coverage on our plan through the COBRA period. But our current health care provider does not allow us to keep them on our policy beyond the 18-month COBRA period. And so we just continue to make the same contribution that we would to a single employee that were employed by the city. In Heber Light Power's situation, they are with BEHP, and they do allow retired employees to remain on their policy. But after the COBRA period ends, the premium increases to 130% of the normal premium for an employee. any questions about health insurance? That's complex, and it maybe some of the biggest differences, at least financially. Well, let's see, one other